Namaste and a very warm welcome to Medical Tourism by Priyanka. I am your host Priyanka Chadha Ahmed, and today we have the pleasure of hosting a very special guest, a renowned orthopedic and joint replacement surgeon from Artemis Hospital, Gurugram, Dr. Rohit Lamba. Dr. Lamba, thank you so much for joining us today.
Hello. Thank you, Priyanka. It's a pleasure to be here.
Dr. Lamba, the whole idea of conducting this show today is to make our viewers, especially the international patients, understand that what kind of orthopedic and joint replacement surgeries we're offering in India. Can you please throw some light on this?
Yeah, so I'll just go by my experience. So I've been working in the international patient forte over the past around almost 12 years now. And across all these 12 years, I've had the pleasure of working with various nationalities, be it from the Middle East, from Iraq. We mostly get a lot of patients from there, from CIS countries, Uzbekistan, Kazakhstan, and the likes, and then from a lot of them from Africa, and even from many more smaller countries across the world. So, in my experience, I've had a pleasure of catering to almost 36 nationalities over these years. Most of these patients are looking for options of treatment for which the treatment is not easily available in their countries.
Correct.
So the high-end surgeries, which are joint replacements and spine surgeries and the likes, these are the ones which are not usually very easily available over there because of the paucity of implants. The implants that the prostheses that we use in our joint replacement surgeries, they're not available freely anywhere.
Yes.
And certainly not the best quality and the best companies are not available there. So that is one category. Then the resurgery becomes even more difficult over there because the resurgery requires of such surgeries of a joint replacement. It requires very furthermore complex and furthermore special implants. So obviously they're also not available there. So a lot of patients come looking for such surgeries. Then there are a lot of patients who've had a fracture or a trauma being treated primarily in their countries. It is not turned out well. The results have not been very good. So they come looking for options after the primary surgery has gone wrong for them. In addition to that, there are a lot of pediatric, small children who've had a congenital deformity. Now, these are very complex and highly specialized surgeries, which are done by a pediatric orthopedic surgeon. So, the pediatric orthopedic surgeon in our team, he caters to all of these complex surgeries. It could be a congenital deformity, which is there since birth, or some kids develop certain deformities or orthopedic problems as they grow along the way. So, that's another category. And apart from that, spine, as I earlier said, spine is a very complex and varied disease syndrome, and it requires a special treatment and care as well. So all of these are the major surgeries you usually cater to.
Okay. So now, Dr. Lamba, this brings me to my very first question, basically, that how do you evaluate if a patient is a right candidate for a joint replacement or a knee replacement for that matter?
Okay, so knee replacement as an index surgery would say. Joint replacement is usually required for patients who have any kind of arthritis. So arthritis per se would mean that if the joint, it could be any joint, it could be the knee, the hip, the ankle, the wrist, elbow, even the shoulder. So all of these joints, they have a smooth covering of cartilage at the end of the bone. That helps in the movement of the bone. Once that cartilage is lost due to any kind of problem, it could be an infection, it could be a trauma, it could be age-related wear and tear. So any of that reason, when the cartilage is lost, the joint develops arthritis. So what the patient feels is there would be stiffness to begin with certain pain, and as the disease progresses, the pain increases. So your joint movement is limited. You're not able to do your normal daily activities, like in terms of knee joint arthritis. You have pain in even getting up from the chair, walking a few steps across the hall. Climbing the stairs becomes a very big problem for them. So, and as the disease progresses, the patient is mainly bound to the house. So that looking at those symptoms is what tells me that the patient has arthritis, which is severe enough to require a joint replacement. And then after that is when I get the tests and X-rays and other things done.
Okay. And by and large, there are also a lot of misconceptions around the knee replacement, which I've come across a lot of my relatives per se, and people who are, we keep encountering when people travel to India and to us for the knee replacement surgeries. So would you like to highlight some of them and why they're not relevant and misconceptions?
Yeah. So surgery is something everyone is already every time scared of, and more so in India. And a lot of patients from abroad are also skeptical how the surgery would turn out, if it be a successful one, if they be able to walk, and how long would the surgery last, how long would it give them benefit. So I've heard so many people from India and even from abroad. The first misconception is that the surgery is going to be very, very painful, which it is definitely not, because that is the, if I talk about the advancements in joint replacement, that is the most uh, recent and the most prominent advancement, which is pain control. So the pain control around the surgery is the one thing which has developed so much in the last 20 years or so, that we can make the patient walk even on the day of surgery. And it is talk of even doing a daycare joint replacement. So there are some countries in abroad like UK and US. In certain selected candidates, they're doing the surgery, and the same day they make the patient walk, and by the evening the patient is back at home. So obviously you can understand how good the pain relief and pain control measures have been.
Absolutely.
So at our center, we use all types of pain control measures, like be it nerve blocks, be it special pain medicines, by pain pump infusions, special pain patches, and all of that. So we use a customized approach to a patient. Whatever is best suited to that patient, we use that category of pain management system, and it works out well for us. We keep our patients usually for 2 or 3 days after a knee replacement or a hip replacement. Next day onwards, or even the day of surgery, every patient is up on their feet and started walking. So that happens only because the pain is well controlled. So that is number one misconception, that pain surgery is very painful, which it is not nowadays. The next is, would they be able to get back to their normal activities? How soon they would be able to? So now the surgical techniques and the implants that we have has allowed near complete restoration of all the activities. So even now we can even ask our patients to squat on the floor, sit cross-legged even after a knee replacement or a hip replacement, and so they are back to driving their own car in 3 weeks time. They're back to the office in 3 weeks, and so they're doing pretty much everything. And in terms of sports, they're doing I mean, we encourage our patients to involve themselves in some recreational activities, but not too heavy, not too demanding on the joints, but still, like golf could be one thing they could enjoy, swimming, doubles tennis or doubles badminton. So the implants that we have now, they have such good life and such good articulation. And then comes the third point finally, which is, uh, would my implant last my lifetime? Yes, that is another misconception. A lot of patients say that they've been told that the joint replacement would last only for 5 years, 10 years at the maximum. That is not true at all. The kind of implants that we have now, we can safely say that they can last for as long as 30, 35 years. So that is another advancement that has happened over the last 10, 15 years, I would say. So that is another misconception which I would like to clear out.
Okay. Thank you so much, Dr. Lamba. So, Dr. Lamba, another very relevant question is sometimes the patients think that, he's too young for a surgery. Maybe he has gone through some trauma, but still that, mindset that I'm too young for the surgery. Or in many cases, people think now we are too old for a replacement or a joint replacement surgery. So, what do you have to say for, such cases? That is there something called too old or too young?
Yeah, funny you should ask that. I'm just coming off a surgery, a hip replacement surgery for a 17-year-old girl.
Okay.
So earlier there used to be a fact that people used to think that the patient is right now too young, because people used to think that an implant for a hip or a knee replacement would last for maybe 5 years, 10 years at the max. So that's why they thought that if a certain person in their 30s or 40s has got a problem, they would have to wait until 50 or 60 to be able to get a surgery. So that's a total myth. That is something we should debunk right now. I would say the major deciding factor for a surgery is how it is affecting your life. If your daily activities are getting affected, it doesn't matter even if you're 13-year-old. I've had patients who've asked for a surgery at even 13-year age, which I usually refuse, because I ask them to get to a certain age by which time the bones have already grown. So, in my book, the only factor deciding the surgery, how young you can do, is has the patient attained skeletal maturity. So, the skeletal maturity is once when the bones have grown to the maximum size they can, which usually happens by 15 to 16 years in the case of girls and 16 to 17 years in case of boys.
Okay.
So, after that, if a patient has a problem which has been there for since he was very young, If it could be a juvenile rheumatoid arthritis, it could be a fracture or a Perthes disease or a dislocated hip since childhood. So such patients will have an arthritis very early in their life. Now you can't ask them to keep limping around, keep living their life in pain and not be able to enjoy their life. So yes, joint replacement has been offered to them and we do it on our own because we want the patient to get back to their normal life as soon as they can. And another factor which has emboldened us to offer them surgery is the fact that we have such good implants. So now the implants that we have, even if we do it for a surgery for a 20-year-old, we expect that to last for 30, 35 years. So that should take him beyond 50 to 55 years of age, by which time, if the surgery needs to be done again, it can be safely done and that could be the last surgery the patient ever has. So being too young for a surgery is not a fact anymore. If anyone is 16 to 18 and if your life is debilitated because of the problem that you have, you're good for a surgery and get it done nicely with minimally invasive approach with the best of implants available and you can live your life without any problems. Likewise, now you go to the other end of the spectrum. Is a patient too old for a surgery? Yes, if some patients, after they get to their 60s or 70s, they start thinking that I don't have much life left. That's not true that's not true anywhere now. Patients from abroad, especially the Europeans, they're looking at living the second chapter or the second innings of their life if after 60, 65. So they want to be as active as they were in their 30s, even going for hiking, fishing, and trips like that. And they want to be actively involved in sports. So they're looking for options which can make them as able and as active even after a surgery. So for them, it's an option. Yes, there are certain factors which we need to look at when a patient is an elderly. There are certain medical conditions we need to control and manage well so that we don't have any complications during the surgery. But most of them are very well manageable and a safe surgery can be done in most of these patients. So there is no other complicating factor which would totally rule the surgery out. So yes, the eldest that uh, I've had the pleasure of doing, I'm not saying pleasure of doing, I've had the opportunity of doing, most eldest patient I've had would be 98 years old. So there was a gentleman from Iraq who's 98 and he was walking around like a 70-year-old only. He wanted a relief from his pain. So I would not turn him away saying that I don't know how many years you have got to live. Even if it's only 2 more years or 3 more years, I should offer him the best that I can.
Yes.
So we did all the evaluation and we were able to offer him a safe surgery. He went back home very happy. It's been more than a year now. He's living his life happy. And I'm looking forward to meeting him on his 100th birthday.
Wow, that's nice to hear. That's really encouraging. Now, my next question is that what kind of pre-tests are required if somebody is planning to come to India, and also whether they should get those tests done in their home country or you advise them to come here and get them done.
Yeah, so most of the patients who come to us, they already have been evaluated in their home countries and they've been told already that what kind of procedure they would require. Or if they do not, then they get in touch with us before they come to us and we get the required tests or the evaluation done. Most of that would be a knowledge of whether they have any comorbid diseases like diabetes, blood pressure, a thyroid problem, or prostate or any other cancer related problem. So all of these, if they have the medical history with them, that comes very handy. So I encourage them to carry all their reports, whatever has been done. Some patients miss getting that and then they expect all to do all the evaluation here in India because they trust the Indian diagnostic services better. So, but I would still want them to carry all their reports, whatever they've already got done. Before they come to us, we usually ask them to get their X-rays, so we can offer them the kind of surgery we're going to do, how much would it cost, how much is going to require them to stay here. So all of that plan can be ready before they come. Once they come over to India is when I prefer doing the major investigation part and the evaluation part, which would be the certain blood tests, which are the routine ones. Then in certain cases, like elderly patients, we require a cardiac evaluation. So that takes a ECG and a echocardiogram of the heart. So that usually is done. Then in certain cases where you require an MRI scan of certain diseases, there could be a tumor which would require a special biopsy. That has to be done in India only. So most of the investigations usually are done once they arrive here.
Right.
But before they come here, if there's something which can help in giving them a fair idea of what they're going to get done, we advise them before even they reach here. So most of the patients get in touch with us and get that done before they come.
Absolutely. Okay, so now this brings me to the next question: is what kind of transplants are there? Because there are, I think, a lot of variety of implants. I'm sorry,
Mhm.
yeah. What kind of implants are there in the knee replacement or joint
A
replacements?
joint replacement. Okay. So first of all, what all joints we cater to? So practically all of the joints would have an implant available across the world. For I mean, in countries like US and UK, they're even doing joint replacements for small joints like fingers and wrist as well. But most of the patients who come here, they come here for a joint replacement of the shoulder, the elbow, the knee, hip, or in some cases the ankle. So if you talk about the most numbers, there are most of the patients are for knee replacements or a hip replacement. Now, if we talk about the kind of implants, uh, they are actually dependent on what is the physiology of the patient,
Mhm.
what is the age of the patient, because depending on the age of the patient, the implant of the hip could be either be a cemented one, which is to be fixed in the bone with a special bone cement. That is true for an elderly patient. And then, if the patient is a young one, we usually prefer uncemented implants. Again, the hip replacement has a ball and a cup. So the ball usually it comes in a metallic form as well, and then there is a ceramic ball as well. So it has been shown the best combination is of implants is to use an uncemented implant on
Mhm.
either side, the cup and the stem. The ball should be a ceramic one, and the cup has a highly cross-linked polyethylene liner inside it. This combination has been shown to have the best results and best outcomes in terms of longevity, in terms of giving a good pain relief of around 30 to 35 years. So that is in terms of hip replacement implants. Now, when come to the knee replacement, the most of the implants are usually cemented ones only. The only difference being whether you require an implant which gives you free movements across bending and twisting of the knee, which is a primary knee replacement implant, or in certain cases where the ligaments around the knee are very uh, damaged already and they're very loose, and you can't trust the ligaments to hold the implant together. In that case, we use a special hinged implant, which provides stability, which provides you bending and straightening of the knee, but not so much the twisting part. So these are grossly the kind of implants that we use. I could say safely that whatever is there available all across the world, even in the developed countries like US, UK, and rest of the Europe, we have all of kind of implants already available here. So
Okay.
we can offer the best kind of implant, the latest technology in implants, and the latest technology in placement of the implants.
Yeah,
So
that brings me to the next question. Like, what kind of advancement, we have seen over the years when it comes to the surgery? Like, uh,
So if we talk about joint replacement surgery, we've had a tremendous improvement in the type and quality of implants and how they are placed. Now, uh, for the last around 10 to 15 years across India, there have been surgeons who've been using computer navigation techniques
mhm.
for the placement of the implants and doing the surgery. So that what computer navigation has been giving us is a system which guides you throughout the procedure to tell you what is the alignment of the joint. If we talk about the knee, what is the alignment of the knee joint? What are the deformities before we begin the surgery? So the assessment is down to the last millimeter or the last degree of deformity. So that's how precise it is, because there's a camera and there are sensors attached to the bones in around the knee, which picks up the signals from the sensors, and the camera picks up the signals, processes into the computer, gives us a nice picture of what exactly the deformity is, then guides us throughout the procedure of how we have to go about doing the surgery by releases of the soft tissues, making the bone cuts. So at the end of the surgery, we get a very nicely balanced knee with the very precisely placed implant, and that gives us the confidence to make the patient walk immediately. The knee being nicely balanced makes the implant that much more longer in terms of the longevity. And yes, the pain relief is also one of the important factors, because you have to cut less of bone, release less of soft tissues. So the pain relief is good, the cut is less, the blood loss is very much less, and the associated risk factors with the surgery become very low. So that is one thing which has been doing for the longest of the time. Then recently, what has come up in the last 5 years or so is robotic.
Mm.
So robotics in joint replacement is another advancement, I would say. It has taken it further one step higher. compared to computer navigation, because the robotics, what it offers is over and above what I've talked about the computer navigation. It does give you everything in terms of alignment and balancing and everything. And on top of it, the bone cuts that are made are done in accordance with a robot. So that, because it is a robotic controlled thing, the human error, the element of human error is minimized.
Absolutely
So a
wonderful.
human error could give it 1 or 2 millimeters here or there, but that error is gone out of the window because the computer would not allow you to cut beyond what you've already planned.
Mm-hmm.
So the planning of the surgery is done before the surgery even starts. You know how much you have to cut, how to place an implant. Everything is precise and to the last degree, to the last millimeter. So that is one thing which has come up over the last few years, and a lot of centers are offering that, and that is at par with whatever the best facilities across the world are.
Okay, so this is like bringing us to the at the global level. So there
It
is nothing
truly is.
beyond this at the moment.
Truly is, yes.
Yeah. Oh wow, that's nice. So that answers our question as to why people should select India when they are thinking of their joint replacement surgery. Okay, so Dr. Lamba, what is the kind of duration of stay which is expected? A patient should keep in mind that if I have to travel for a knee replacement, I should be in that country for this many amount of days.
Yeah, so I would say a patient for a single knee replacement, one side knee replacement, they stay in the hospital for 3 days,
Mm-hmm.
and likewise for a both side knee replacement, they stay for 5 days. That's the hospital stay that is usually required. So you come to India, you give a few days for the evaluation before the surgery, then the surgery and the stay in the hospital, and then you give another 10 days after that. So I would say 2 to 3 weeks is the usual amount of time patients stay here in India,
Mm-hmm.
and that's usually enough to get them confident and recover well enough to travel back home safely.
Okay. So the post number of days which you mentioned in the hospital is also, does that include the rehabilitation and the physical therapies as well?
Yeah, as long as they're here in India, we take care to give them the best in terms of rehabilitation as well. So our physiotherapists are up and about with them every day. So some patients require more attention than others. So yes, they every day, once in a day, the physiotherapists go to them, even at the place that they stay at the hotels, and offer them their services. And so
This
till
is,
the time the patient is here in India, we are with them to offer them the rehab as well.
but Dr. Lama, does these rehabilitation or the therapies play an important role in the recovery process?
Yeah, absolutely.
Mm-hmm.
Certainly so, because the surgery is not the end point.
Mm-hmm.
The recovery surgery is one the surgeon has taken off the gloves, then there's nothing in control of the surgeon.
Mm-hmm.
Then it's upon the patient to get the required physiotherapy and rehabilitation done. So, because a lot of these patients have been battling these disorders and this problem for many, many years, like 10 years, 20 years even. So it's not just the joint that is damaged, because we're just replacing the joint. We're just replacing the damaged part with an implant. We're not doing anything to the rest of the leg or the body around it. So there are muscles around it which have become atrophied, they've become weak over the years because patient has not been walking much. So that needs to be strengthened, and that's not a one-day job. That takes months. So the patient needs to get into that habit of doing the exercises and rehab, and that is why I say they stay here. It should stay here for not less than 2 weeks, ideally at least 3 weeks, so that they get into the habit of doing those exercises, and the initial pain and discomfort is gone, and they're able to do it comfortably, so that they, when they go back home, they don't lose that habit and they continue doing it. I prefer my patients doing the exercises on their own, well into the 6 months after the surgery, because that's as long the recovery is still happening even after the surgery. So the surgery is not the end point, and the rehab is very, very, very. I can't stress that enough.
Okay, okay, all right. So, by and large, I understand this post the surgery, after 2 to 3 weeks, can a person join back the office, or that's too soon?
Yes, if you happen to have one side surgery, like if it's a one side knee replacement or a one side hip replacement,
Mm.
by 3 weeks, I usually allow my patients, if they've done their physio well, if they've done their rehab well,
Mhm.
you should be fit enough. But that is for the younger lot, right?
Okay.
So if you're looking at someone who's 25, 30, even up to 45 or 50, I can allow them to start driving a car. An automatic would be the first one to get your hands on. And then if you're starting to drive, you can safely go back to your office as well. So it's a matter of getting confident while you walk. Obviously, after a joint replacement, we'd ask our patients to use some kind of a support, like a stick or something, for at least 6 weeks, So with a stick, they can walk around any way they want. So I usually allow them to go back to office by 3 weeks if they're
Okay. So, a lot of international patients are inhibited that what if we go back to the country and we need the post, treatment support. So,
Mhm.
what kind of support there you offer to your patients?
Yeah, that's a tricky one because that actually depends on the what kind of services they have in their own country. So over the years, we've had developed a lot of good contacts in some of the major countries, like in Iraq and Uzbekistan, and some countries of Africa as well, where we know some of the local physicians and some local physiotherapists as well. So if it's a matter of just sending them on to the right person who knows what is happening with them, I do. We usually do send them to some people we know, but that's not true for every case and not true for every
Mm-hmm.
country.
Mm-hmm.
So we're available for them by video consultation after the surgery once they've gone back home, and usually maybe it's only 1 out of 10 who usually requires any further confirmation of the doubts over something. But yes, we are available for them anytime they want us to. So that is one thing we can offer. Then we can also offer them to uh, get some particular evaluation or consult a local surgeon, and then we are happy to discuss with the local surgeon as well, so as to their care can continue
Okay.
uninhibited.
Yeah, but certainly the video consultations are always there for
Yeah,
them.
yeah,
They
surely.
can come back to
Yeah,
you and can
once a
have
patient,
their
always a patient for us.
yeah, absolutely. Also, so now I understand by and large, what kind of the knee replacement horizon we are looking at in India at the moment. But are we competing globally? See, when it comes to India, it's very clear that uh, if I think myself as a patient and if I have to make a choice, yes, I know if I have to travel to Singapore or maybe a country in Europe for a knee replacement or a joint replacement, okay, I know that India is a country where I'll get the treatments at very, very affordable cost.
Yep.
That's a well-known fact. But am I compromising on quality? Though you have answered this earlier, I still want to understand that are we competing globally when it comes to quality in
Yeah.
orthopedic surgeries?
So, see, as is true for any other field, uh, manpower or the human resources are biggest strength, right? For India, if you're talking about, so it's true for medical field as well. So we've got if you look at the doctors who are working there in UK, US, you'd find at least 40% of them are already from India.
Yeah.
You find so many of Indian names if you look across a roster of doctors at any hospital there, and most of them are very well known. So so far so that if you consider the grandfather of joint replacement across the world has been an Indian, Dr. Chitranjan Ranawat, who went there like almost 50 years back.
Mhm.
So that's how well trained the Indians have been across the world, and that's how good the medical services have been in India. So a lot of those doctors have come back in. A lot of our doctors have gone there and trained with them. So now it's a global exchange of knowledge. So it's not like those techniques or those technologies are limited to them. As soon as an implant is launched, next year is available in India,
Mhm.
right? So that's the technology is there. As soon as a new technology in terms of robotics or any other field is launched, next year is there in India, even the same year. And so in terms of training and uh, yeah, accomplishments, our Indian doctors are second to none. So if you're offering something which is as good as what is being offered across the first world, and at a much more lower prices, that is what we offer here. So it's a combination of both.
The best
I
of
would
both
say
worlds.
best of both worlds.
Yeah.
For the patient, it is a win-win in any scenario.
Yes, absolutely. And Dr. Lamba, are we seeing any future advancements with respect to these surgeries? Anything in the pipeline which we can expect?
Yeah. So as you would know, that AI is one big buzzword going across,
Absolutely.
right?
Ji, ji.
So that is one thing which is coming up in a big way. How it takes over in the medical field is, for now, we've heard a few buzz around the diagnostics, which have been taken over by AI. Google has come up with their own software which can help us in diagnosing a CT scan or reading out a CT scan or an MRI scan. That is where they've started. And obviously, I don't think AI is going to take over a surgery as yet.
Mhm.
But yes, that is what is going to be the next advancement in the field of surgery. It would help us in planning out the surgery much before we actually go into the surgery,
Oh,
because that is one thing that even with the best of techniques in it, you can still have surprises when you start a
mhm.
surgery, and you can
Mm.
suddenly end up feeling that you need something else, something more advanced as well. So yes, that is one thing that would come up in a big way. And then the advancement in the implants is another thing, which I think should allow us to do all of such activities which a young person would want. The a young person wants to get all of his life back, all of his activities back. The ability to play sports, the ability to run, jog, do any kind of thing uninhibited is one thing which young people are looking at. So we hope in the future we are able to develop such implants, which is going to allow all of that, and the no restrictions. We almost there, but yet there are some restrictions in terms of what you can do and what you cannot.
Okay. So now this brings me to the very last question, Dr. Lamba, that being a medical tourism, company ourselves, we get a lot of queries from different ethnicities, like African, Uzbekistan, Arabic. People are different. And you being an Indian doctor, how well Indian doctors are equipped to handle such cases?
Uh, Maybe when it all started, you might have said that we don't know much about their basic ethnic problems. Huh? It could be the case, but now over the past, medical tourism has been on in the country for more than 20 years now. I've been part of it for almost 12, 13 years now. So I think I would have seen the most of the spectrum of whatever problems they come up with. There are certain things which are endemic to certain countries. Like if you talk about Africa, uh, there are sickle cell disease is a very common problem there. So now what it does is it opens up the possibility of offering them a bone marrow transplant to cure them. But then once it has been there for long enough, it can affect their joints as well.
Okay.
So sickle cell disease affects your joints to the extent that the bones become arthritic, the joints become arthritic, and the bones are very, very hard. They're hard as a rock. So such patients require special implants. They require such special techniques to do their surgery, and which we've had the experience for long enough.
Yes.
And the experience is shared across the world. I mean, there is a lot of literature been published earlier from Africa and from Europe, but now that we've had so many of such patients being operated here, we have enough data and evidence which guides us what all to expect, how to manage such patients, and how to offer them a good surgery. That is one thing. Then again, for patients who for certain ethnicities require certain activities after the surgery, like patients from Iraq or certain other Gulf countries, they would want to squat or sit on the floor or offer namaz, right? So they would expect that after a knee replacement, they're able to offer namaz. So it's obviously not for everyone. For some people whose bone quality is good, whose weight is not very too much, you can allow that activity to be done, maybe once in a while, maybe not every day, but maybe once in a while. So as per the ethnicities and their particular social requirements, you have to
and their
cater them
overall health
accordingly.
as well, like how they're taking
Yes,
care of
yes.
themselves. Okay. So it was a very, very informative session, Dr. Lamba. Thank you so much. I hope this video has answered a lot of your queries, and especially to our international patients who are still contemplating whether they shall be traveling to India for their orthopedic surgeries or joint replacement surgeries or not. I think it's a big yes for them. And in case if you have liked this video, so please do like it, do share it, and do subscribe our channel so that we can keep continuing to bring such useful information for you henceforth. Your health is our priority. Signing off, Priyanka Chadha Ahmed. Thank you so much, Dr. Lamba, once again. Thank you so much.